Doctors, researchers, and lawmakers are coming together in one place to talk about mental health. A mental health summit is taking place next week, and it's going to focus on what can be done for racially and ethnically diverse populations. Victor Armstrong is the director of the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services at the State Health Department. And Victor is joining us now to share the 4 takeaways you'll get from the summit. And Victor, it's so good to see you. Thanks for joining us today on QC at 3.
Thank you for having me.
So mental health, I mean, it's an issue for just about everybody on some level in our community, especially now during the pandemic. But this summit is going to focus especially upon diverse communities. Why?
Yeah, I think one of the things that we learned very clearly from the COVID pandemic is that there are very distinct health disparities that impact historically marginalized communities. Mental health is no exception. One of the things that we do see in the mental health space is that when we look at things like suicide, for example, we see suicide rates where they're going down for certain segments of the population, they're increasing in Black and brown communities. And we realize that part of that is because we really don't have a lot of interventions that speak to the nuances of race and ethnicity and culture. And so part of what we want to do is bring people together to have discussions about what we can do to really bridge that gap and mitigate some of those challenges.
Okay, so in terms of takeaways, one of those things that you are aiming for this weekend is naming those specific strategies to promote equitable mental health outcomes. Okay, breaking that down, does that mean you're focused upon making sure that people of color or people of diverse communities also get the benefits of mental health?
Yeah. So it's about equity and realizing that at its core, equity is about allowing people to be as healthy as they can be and being able to live their best lives and have the opportunity for the best possible health outcomes. So our focus for this summit will be on looking at those historically marginalized communities, those ethnically diverse communities, and looking at what kinds of specific strategies and interventions do we need in those communities. We know, for example, that for African Americans are 20% more likely to report psychological stressors than our white counterparts, yet we are less likely to engage in treatment, more likely to terminate treatment prematurely. And we want to begin to peel back the layers and look at why those disparities exist, but also look at the things that we can do to begin to mitigate some of those things. And we know that some of the answers already lie within our communities. And so we want to bring folks together. We want to bring elected officials together. We want to bring clinicians. We want to bring people from all across the spectrum, faith-based community. We want to have conversations about how we can partner together to address some of these challenges.
Well, knowledge is power. We know that to be true, and that's one of the strategies you're going to be focusing upon this weekend. Talk to me about that.
Yeah, and you know, we do want to bring in experts, and we want to talk about the evidence-based practices, but we also recognize that part of the challenge, even with our evidence-based practices, is that many of those treatment modalities and interventions really weren't created and developed thinking about some of the nuances of race and culture. So we want to bring people together to talk about those evidence-based strategies, but we also want to layer along with that community-based strategies. How do we take these evidence-based strategies and use them in communities where they may not have been utilized before? One of the other challenges that we know we have even around utilizing these strategies is that when we think about how we apply policies and resources and provide access, we often think about it in aggregate numbers, that we're trying to reach a larger segment of the community, but we could reach 75% of the community and still miss 75% of the Latinx community. So part of it is looking at these evidence-based strategies, but then how do we make sure that these evidence-based strategies are reaching these communities that we have not historically reached before?
Okay, so you touched on resources, and finally, have about 15 seconds left, but talk to me about intervention a little bit. Number 4 on your list of takeaways, understanding implications for education, practice, and
we want to be able to walk away from this with things that we can put into play, put into practice, and begin to intervene, begin to move the needle, begin to bring about change. equity is about two things. It's about doing things differently, but it's also about achieving different outcomes. And we want to go away from this with ways that we can achieve different outcomes.
All right, I love it. If folks want to find out more information, we're going to give you all of that information, and there it is. Okay, it's happening Friday, the 24th. Very
Absolutely.
good. So good to see you. Thank you so much for joining us.
Thank you. Thank you.